Tennis elbow, also known as lateral epicondylitis, is by far the commonest elbow condition that I see in my practice. It is a condition that involves pain on the outer aspect of the elbow, as well as swelling and tenderness. Paradoxically, less than 10% of people who suffer from tennis elbow have actually played tennis. In medical terms, it is a chronic, recurring condition called tendinosis, which involves microtrauma and repetitive injury to the area of the lateral epicondyle. The forearm muscles, called the forearm extensors, attach to a common extensor origin tendon that attaches on that bony point. This is the main tendon involved in tennis elbow disease. Tennis elbow is incredibly common in office workers who sit at a desk all day, typing on the computer or work with their mouse. They get pain and tenderness as well as swelling in the forearm muscles, especially pain on the outer aspect of the elbow. This can be debilitating, and sometimes people are unable to open a door or shake someone's hand. There is also morning stiffness that people can experience, and the inability or disability to grasp objects at a distance. This obviously becomes a nuisance after some time because people cannot go about doing their activities of daily living, including their sports and hobbies. If this persistent dull ache carries on for the first 3 weeks, and you find you're unable to complete your activities of daily living at work, in the office, or even at home, you should not hesitate to go and see your general practitioner and see a specialist. Physiotherapy is crucial and an integral part of the pathway in tennis elbow treatment. Physiotherapy involves stretching the extensor tendon along the lateral epicondyle. Performing stretches in the first 4 to 6 weeks is highly beneficial for tennis elbow treatment. Thereafter, patients can do strengthening activities, which will indeed cure the problem long term. There are ways and means to get to the physiotherapy, and as far as injections are concerned, I do not recommend steroid injections. There are some recent literature that has shown that steroids can be harmful in the long term for tennis elbow. However, new information has come to light with regards to platelet-rich plasma injections, otherwise known as PRP. What PRP involves is taking blood out of the patient's arm, then putting that sample in a special machine called a centrifuge machine. The blood spins for 5 to 10 minutes, and then we re-inject the blood back onto the affected area. The platelet-rich plasma protein is indeed the blood that has been gone round the machine, has been enriched with cells that we all have in our own body called platelets. The platelets contain significant and different growth factors that are involved in dealing with the inflammation and dealing with the pain, and sometimes even can promote healing to the damaged tissue. I strongly recommend platelet-rich plasma protein treatment to patients that come and see me in the acute stages of tennis elbow. Surgery is reserved for those very resistant cases that fail to respond to non-operative management, such as injections and physiotherapy. Surgery involves a general anesthetic and a small incision along the lateral epicondyle of the elbow, releasing the diseased portion of the tissue that is inflamed and reattaching the healthy tissue back on the bone with special anchors. This can be done either via open surgery, like I said, with a small incision, or sometimes via arthroscopic elbow surgery as well, depending on the severity of the condition. It is rare that I advocate surgery because in the vast majority of cases, non-operative management works very well. In reality, in most cases, tennis elbow is a self-limiting condition. Invariably, it will settle without any additional treatment. However, this may take a few months and up to 2 years in a lot of cases. It is not uncommon for this to become very chronic and for people to be very debilitated by this. That is exactly the reason why I do not want most individuals to wait that long for this to happen. They should seek treatment early and specifically and come and see us to have a special treatment plan with regards to platelet-rich plasma injections, physiotherapy. That way, their quality of life will improve much quicker.